But we start this morning with the COVID-19 pandemic. Christmas just 2 weeks away, and the expected and feared post-Thanksgiving surge continues here in the U.S. And this coming as we are now just days away from the distribution of the first COVID vaccines here in the United States. And Anjalee Khemlani joins us now with all of the latest developments. Anjalee, fortunately, on the vaccine front, unfortunately, as I mentioned, case numbers continuing to rise.
That's right, Miles. So looking at it, of course, we know those numbers are going to continue rolling in. We expect at least another week before we know fully the picture of the post-Thanksgiving surge. And that is what health experts have been warning about. Meanwhile, we know yesterday, listening in on that vaccine advisory meeting, a lot of questions still about who specifically should be receiving the Pfizer-BioNTech vaccine, which is expected to receive that emergency use authorization by this weekend, with the first jabs expected Monday or Tuesday. We know health systems have already started scheduling their vaccinations for frontline health workers on Tuesday. That vote yesterday, 17-4, really spread around the nose, spread around the concern of the younger population that was part of that recommendation. So 16 and 17-year-olds was something that there is not enough data to support that, because the trials focused on the adults, as well as the idea that they may not need the vaccines just yet. Meanwhile, other decisions for the FDA to consider include pregnant women or people with allergies. We know that report from the UK of two people who had allergic reactions has spurred some concern, and so the FDA does have to weigh in and advise for the providers as well as the recipients of the vaccine who should and should not be getting that vaccine. Meanwhile, what will happen to clinical trials based on the fact that individuals might choose to leave once a vaccine becomes available could hamper the monitoring process that's supposed to go for the next 2 years in order to really understand the safety of the vaccine. But meanwhile, as it stands, we know that it is likely that this vaccine is going to start rolling out next week.